1. A nurse educator is designing a clinical simulation for nursing students to develop prioritization skills. Which component best demonstrates alignment with adult learning principles? A. Assigning a lengthy textbook reading before simulation. B. Providing a detailed rubric after the simulation. C. Allowing students to debrief and reflect on their decision-making. D. Grading only on technical accuracy. 2. During a clinical evaluation, a preceptor observes a student failing to identify abnormal vital signs. What should the preceptor do first to apply the nursing process effectively? A. Document the incident in the student's permanent record. B. Reassign the patient to a different student. C. Ask guided questions to assess the student's reasoning process. D. Immediately notify the clinical instructor for dismissal. 3. A nurse manager is mentoring a new graduate nurse. Which strategy best fosters clinical judgment? A. Allowing the nurse to work independently from day one. B. Providing daily quizzes on protocol. C. Engaging in reflective discussions after complex cases. D. Limiting feedback to formal evaluations. 4. When designing a clinical evaluation tool, what must be prioritized to ensure validity and compliance? A. Including broad behavioral descriptors. B. Using only subjective ratings. C. Aligning items with learning objectives and NCLEX standards. D. Minimizing the number of competencies for simplicity. 5. A nursing instructor asks students to reflect on their experience after a patient emergency. Which component of the clinical judgment measurement model is being addressed? A. Recognize cues. B. Analyze cues. C. Evaluate outcomes. D. Reflect. 6. A nursing mentor uses Socratic questioning during clinical rounds. This technique is primarily intended to A. Evaluate task completion. B. Promote critical thinking. C. Demonstrate authority. D. Reinforce memorization. 7. Which instructional strategy best supports novice nurses in transitioning knowledge to clinical judgment? A. Assigned readings. B. Role modeling and discussion. C. Online quizzes. D. Independent learning modules. 8. What is the primary purpose of using unfolding case studies in a nursing curriculum? A. To test memory. B. To simulate long-term clinical decision-making. C. To measure dosage calculation skills. D. To evaluate instructor effectiveness. 9. A clinical instructor provides feedback stating, "You need to be more aware." How can this feedback be improved to enhance learning? A. Rephrase it as a compliment. B. Add specific examples and suggestions for improvement. C. Keep it vague to promote independence. D. Deliver it only during the final evaluation. 10. A nurse is precepting a student and wants to assess their ability to anticipate complications. Which question best facilitates this evaluation? A. What are the patient's current vitals? B. Why did you choose that intervention? C. What complications could arise from this condition? D. What room is your patient in? 11. Which method best evaluates a student nurse's ability to implement the nursing process in real time? A. Written care plan assignment. B. Multiple choice exam. C. Direct observation with guided questioning. D. Group project on patient education. 12. Which scenario illustrates effective use of evidence-based practice in clinical instruction? A. A nurse educator relies on past personal experience. B. A clinical preceptor uses articles to guide student decision-making. C. A mentor uses informal stories to teach. D. An instructor forbids deviation from traditional routines. 13. A nurse educator wants to enhance clinical decision-making. Which activity should be integrated into post-clinical conferences? A. Reading NCLEX practice questions. B. Lectures on hospital policies. C. Group analysis of case scenarios with patient outcomes. D. Reviewing the day's schedule. 14. Which technique most effectively supports formative assessment in a clinical setting? A. Weekly final evaluations. B. Use of checklist without comments. C. Ongoing observation with real-time coaching. D. Annual performance reviews. 15. What is the best way for a clinical instructor to model professional communication? A. Speaking only during emergencies. B. Discussing staff performance in public. C. Demonstrating therapeutic communication with patients. D. Using clinical jargon exclusively. 16. When mentoring a new nurse on medication administration, the mentor should first, A. Test them on pharmacology. B. Review the 5 rights and observe a real scenario. C. Assign independent study. D. Avoid interfering with their established habits. 17. A student nurse incorrectly assesses a patient's lung sounds. Which mentoring approach supports clinical growth? A. Immediately correcting and moving on. B. Asking the student to explain their assessment process. C. Providing the correct answer. D. Repeating the assessment without discussion. 18. Which curriculum feature most promotes critical thinking and clinical judgment? A. Lecture-only format. B. Case-based learning with peer collaboration. C. Strict memorization of textbook material. D. One-time high-stakes exams. 19. Which of the following actions best supports regulatory compliance in nursing education? A. Allowing flexible learning goals. B. Aligning all evaluations with Board of Nursing competencies. C. Encouraging subjective grading practices. D. Avoiding documentation of student performance. 20. A nurse educator assigns a root cause analysis after a clinical error. This strategy primarily teaches students to A. Avoid future assignments. B. Memorize policies. C. Analyze systemic issues and improve judgment. D. Shift blame appropriately. 21. What element is essential in developing curriculum aligned with the NCLEX clinical judgment model? A. Simplified test-taking strategies. B. Practice in setting alarms. C. Integration of cue recognition and prioritization scenarios. D. Emphasis on memorization of care plans. 22. A nurse educator wants to foster metacognition in students. What is the best method to achieve this? A. Provide test keys. B. Ask students to journal their clinical decisions and reflections. C. Increase simulation hours without feedback. D. Reduce clinical hours. 23. What should be the priority when evaluating a student's patient care report? A. Writing mechanics. B. Grammar and punctuation. C. Clarity in clinical reasoning and prioritization. D. Use of advanced vocabulary. 24. A nurse mentor models appropriate documentation techniques. This supports A. Increased charting time. B. Role confusion. C. Legal and regulatory compliance. D. Reduced patient care. 25. During a simulation, a student fails to escalate care when vital signs deteriorate. The instructor should A. Stop the scenario and restart it. B. Wait until the final grade to address the issue. C. Debrief with guided questions on missed cues. D. Let peers critique the student. 26. What is a key component of clinical judgment that should be evaluated in high-fidelity simulation? A. Wardrobe choices. B. Emotional attachment. C. Prioritization of care. D. Artistic expression. 27. A nurse educator reviewing program outcomes finds students struggle with evaluation in the nursing process. What should be adjusted in the curriculum? A. Add more pharmacology content. B. Reduce clinical hours. C. Integrate decision-based scenarios that require outcome analysis. D. Increase lecture time. 28. Which method helps promote effective clinical communication between students and instructors? A. Weekly anonymous surveys. B. Assigning communication logs. C. Structured pre- and post-conferences. D. Use of a pass-fail system only. 29. A preceptor notes a student's hesitation in delegating care. What teaching strategy can improve this skill? A. Avoid assigning delegation tasks. B. Discuss delegation principles and role-play scenarios. C. Provide a list of forbidden tasks. D. Assign more documentation instead. 30. What aspect of adult learning theory supports giving students autonomy in clinical decision-making? A. Passive observation. B. Instructor-led discussions. C. Self-directed problem-solving. D. Structured memorization drills. 31. A nursing student suggests an incorrect intervention. The instructor should respond by A. Stating it is wrong and giving the right answer. B. Asking the student to explain their rationale and guiding them. C. Ignoring the suggestion. D. Repeating the correct procedure without discussion. 32. When designing evaluation rubrics, what ensures fairness and effectiveness? A. Subjective grading. B. Criteria based on observable behavior and NCLEX standards. C. Lengthy, narrative descriptions. D. Infrequent grading. 33. A nurse mentor encourages a new graduate to reflect on each shift. This supports A. Checklist completion. B. Memorization. C. Continuous improvement in clinical judgment. D. Increased overtime. 34. A clinical instructor must address repeated errors by a student. The best approach is A. Punitive grading. B. Private, constructive feedback with a plan for improvement. C. Reporting to HR. D. Ignoring it until final evaluations. 35. A nurse educator designs a course including frequent, low-stakes assessments. The benefit of this is A. Grade inflation. B. Promoting ongoing feedback and learning. C. Reducing curriculum length. D. Avoiding stress. 36. Which best describes a mentoring practice that aligns with adult learning theory? A. Delivering lectures only. B. Encouraging learner autonomy and providing feedback. C. Focusing on rote tasks. D. Avoiding learner input. 37. Which evaluation method most accurately captures real-time clinical reasoning? A. Written multiple choice test. B. Simulation with real-time decision prompts. C. End-of-term essay. D. Peer review. 38. A new instructor wants to improve student accountability. Which action supports this goal? A. Assign only group grades. B. Require self-evaluation and reflection activities. C. Grade based on attendance alone. D. Eliminate individual assessments. 39. A clinical nurse educator wants to introduce peer feedback. Which guideline is essential? A. Keep feedback general. B. Focus on personality traits. C. Use structured, objective criteria. D. Deliver it anonymously without context. 40. Which communication strategy is best for addressing a student's unsafe clinical behavior? A. Public reprimand. B. Written warning only. C. Immediate private discussion with documented plan. D. Group discussion on errors. 41. A curriculum committee plans to revise clinical objectives. Which step must occur first? A. Write new test questions. B. Identify expected clinical competencies and align with NCLEX. C. Choose textbooks. D. Reduce clinical hours. 42. What mentoring strategy supports the transfer of classroom knowledge to clinical practice? A. Silent observation. B. Verbal quizzing only. C. Guided questioning during patient care. D. Independent chart reviews. 43. Which of the following best demonstrates application of evaluation in the nursing process? A. Initiating a care plan. B. Determining if an intervention was effective. C. Gathering patient history. D. Delegating a task. 44. A nurse educator creates a learning activity to identify patient deterioration early. This aligns with which clinical judgment step? A. Generate solutions. B. Take action. C. Recognize cues. D. Evaluate outcomes. 45. A nursing mentor asks a new graduate, what signs would make you escalate this case? This question targets which level of clinical reasoning? A. Cue collection. B. Reflection. C. Anticipatory thinking. D. Basic recall. NCLEX Clinical Judgment and Nursing. The NCLEX Clinical Judgment and Nursing Process section evaluates a nurse's ability to apply critical thinking and clinical reasoning in patient care. This part of the exam focuses on assessing, diagnosing, planning, implementing, and evaluating the core steps of the nursing process. It emphasizes the use of clinical judgment to make safe, evidence-based decisions in complex, real-world scenarios. Candidates are tested on prioritization, recognizing cues, analyzing data, generating solutions, taking action, and evaluating outcomes. These skills are essential for responding effectively to patient needs in dynamic healthcare environments. This section ensures that newly licensed nurses are ready to provide competent, patient-centered care. Here are the top 5 beneficial uses of mastering NCLEX clinical judgment and nursing exam. 1. Licensure success. Understanding clinical judgment is essential to passing the NCLEX, which emphasizes real-world nursing scenarios and decision-making. 2. Patient safety. Strong clinical judgment helps nurses recognize early warning signs, prioritize care, and prevent complications. 3. Effective care planning. It ensures nurses can assess patient needs, interpret data, and implement evidence-based interventions confidently. 4. Real-time decision-making. Clinical judgment skills enable nurses to respond quickly and appropriately in complex or changing patient situations. 5. Career readiness. Mastery of clinical judgment prepares new nurses to transition smoothly into practice and excel in diverse healthcare settings.